covering the care sector throughout this crisis. Yesterday, it almost felt to many people like the government was catching up with some of the things that you've been pointing out.
Yeah, Susanna, what's measured is what counts. And finally, the statistics have begun telling the story we've been hearing for weeks from carers, which is that they couldn't contain Covid-19. And if you delve deep into that data that we got finally yesterday, you'll see that more and more of the deaths that are happening with Covid-19 are now taking place in care homes as opposed to hospitals. We went to one care home yesterday where they'd normally have around 2 deaths a year. Sadly, they have been having about 2 deaths a week during this crisis. And if you speak to the carers there, what scares them isn't just sort of the speed of the spread here, but the fact they haven't known where it's coming from. We've spoken about this before. There wasn't any testing, and for too long there wasn't any PPE.
You know, Paul, there's a very interesting thread from a woman called Jo Woodward that's now being picked up by various journalists. I was going to take a little time to read it because it's really interesting insight into what may have been going on in care homes. So I think it's time to point out that residential facilities for older people from low care to high dependency have several things in common that make them absolute hotbeds of infection and cross-contamination for residents and staff. 1, they're overheated. 2, ventilation with fresh air is often negligible, especially in colder weather. 3, residents often have little access to the outdoors or sunlight. 4, food is served in communal dining rooms where everyone's expected to be served at the same time. 5, residents spend much of their leisure time in each other's company, again, communal areas. 6, staff move constantly within the building and between patients. 7, there'll be several shifts with changeover, meaning each shift interacts with the one before and the one after. 8, during a normal day, there'll be non-care staff, cooks, maintenance personnel. 9, there'll be visitors, including GPs, social workers, family members, delivery drivers, even the postie. It's possible Covid-19 could have been brought into a facility before anyone even knew there was a risk. And then she goes on to offer more observations. But it was a very clear-sighted analysis, really, of the many different ways that Covid can come into a care home and then spread exponentially.
Absolutely, and I could add so many more to that list, Piers. For example, in homes where a large percentage of residents have dementia, how do you isolate them when often they want to wander outside of their rooms? They can't understand social distancing necessarily or remember to follow social distancing. And I think one of the big problems with all of this, actually, if you're pointing this back at the government, is that it's called the Department for Health and Social Care, but we know that social care often drops off the end of that, and the government, perhaps understandably, threw everything it had at the NHS right at the beginning of this pandemic because it could not countenance a crisis in our hospitals, and it has taken a while for them to realise that this is now spreading through care homes at such an alarming rate. Many of these are private providers. It's just not the same kind of network that you get with the NHS, where everything's joined up and you can follow the virus and track the virus and its spread. And this is a problem. I know you've got Jonathan Ashworth on, but this is a problem going back decades. Governments haven't put social care on a par with the NHS.
Well, let's talk to Nicola Richards. As you say, we've got Jonathan Ashworth standing by, but Nicola Richards is director of Palms Row Healthcare. You run 3 homes in Sheffield, Nicola. At the beginning of this crisis, what support were you getting from the government when it came to testing in particular? And were you being asked to take in residents, patients from hospital, as they tried to free up beds who weren't being tested?
We did have an issue with testing. We got hit by this, unfortunately, 5 weeks ago. So, you know, we've been fighting this for many weeks now. And we did actually, you know, we were still open to admissions from hospital and from the community. So, you know, yes, we did accept residents in during this time.
So do you think, I mean, I don't know what the situation is in your 3 care homes. What is the extent of COVID there? I know that you've suffered the virus and loss, haven't you?
Yes, we have. We've seen sadly 18 deaths across our group over the last 5 weeks, but we haven't felt that the support's been there, and it's been incredibly sad and challenging for all of us and providers, you know, across the city, across the country. You know, the support's been lacking, sadly.
So, and can you just articulate how that looks when you've asked for instance, tests when you've suspected COVID in a home? you been able to get them?
No, it's been difficult. The testing's been limited. We are now starting to see, you know, an increase in that coming through now. But again, several weeks ago, when announcements are made, this just puts further pressure on us when we haven't got the systems and processes in place locally to cope with that.
Let's bring in Dr. Jane Townsend. You obviously oversee a lot of people in the community. That's another part of this war, isn't it? Many people dying at home, we can now see from these numbers that have come out, including many with Covid-19, and many perhaps, we don't know the answer to this, I don't think at the moment, many perhaps dying from not going to hospital in time because they're worried about getting the virus if they go to hospital.
Yes, understandably, there's been substantial media attention on hospitals and care homes. Our fear is that the third scene in this unfolding tragedy will be in people's own homes, people dying unseen because the home care workers that normally support them won't be able to go anymore because the companies they work for will go bust, and family carers will be unable to cope. The death statistics don't look good. 4,570 people dying of all causes in their homes. The data suggests about 20%, 883 from COVID-19, but we honestly don't know because no testing has been done. Very few home care workers have been tested, very few people in their own homes have been tested. So that number is likely to be higher. And also, in addition to the point you make about people not going to hospital because they're afraid of infection and they also don't want to be a burden on the hospitals at the moment, we're also seeing councils cancelling care calls, in some cases to save money, and also citizens themselves cancelling calls because they're afraid of infection. And that has been made worse by the fact that home care workers have struggled to access personal protective equipment.
Well, let's bring in Jonathan Ashworth here. Jonathan Ashworth, I mean, if this pandemic had happened in 2008, after more than a decade of Labour government, I don't think that care homes would have been any better protected, from my knowledge of what was going on then, than they are now. So this has been a generational problem of care homes being seen as second-class citizens to the NHS and hospitals.
I mean, it's certainly true that our social care sector has been deprioritised for years and years, which is why we wanted to introduce a national care service. That was one of the big policies that Gordon Brown was putting forward in the 2010 general election. Sadly, Gordon Brown didn't win that 2010 general election, but it was a recognition that we had to change the way in which we delivered social care. Take your point, it was probably too late that we recognised that, but we were certainly moving in that direction. I mean, what we've now seen in this crisis is absolutely devastating. If you look at the figures from yesterday, it suggests that 5,281 people have now died in care homes. That is an absolutely terrible, devastating figure.
That's probably a massive understatement. I mean, we had a journalist from the Financial Times who's been crunching all the data on this, and he has estimated, he thinks it's a cautious estimation, that 46,000 people have now died in this country from COVID-19.
And that suggests we are tracking as one of the worst countries in Europe, which I think casts a dark shadow across the nation.
Not just that. We would be comfortably the worst in Europe at the moment. The graph was quite clear at the daily briefing yesterday, but we're now the second worst in the world. And we're up with the United States, which is having a catastrophe unfurling there. Many would argue for many of the similar reasons we are here. They were too slow to react and they were woefully underprepared.
I think that's right, and it is devastating. But I think it strikes me that we've been particularly underprepared in our social care sector. If you think about what the NHS have done, they've set up new Nightingale hospitals, they've freed up beds, they've brought retired staff back. The NHS managers, the NHS leadership in that respect have done a good job. But if you think about what's happened in social care, I'm not convinced there's been the same level of detail and planning that has gone into social care from the very top. That's not to criticise the people who work in social care. I'm talking about the people at the top, at the very top of government, who are responsible for social care, because we've not been able to get the PPE out to social care staff. We've not had clear guidelines for how to support people who are either locked away in their homes, who can't see their grandchildren, can't see their families, and all the awful, awful implications of an elderly person being locked away in their homes on their own. And we've not had clear support plans and guidance from the top on how to support people in care homes and nursing homes.